OCD has somewhat of a close relative, like a cousin, called Obsessive Compulsive Personality Disorder. Now, these things are very different entities. Occasionally, folks will have both of them, but we tend to think of them as separate. Now, OCD, as we've talked about already, is this kind of fear-based condition where a person has these obsessions that make them very uncomfortable, and they engage in behaviors or rituals to try to mitigate the fear of that bad outcome happening, as well as reduce the stress. Now, in OCPD, it's a little bit different. OCPD involves this kind of characterological, persistent way that the person interacts with the world, in which they have this level of high level of rigidity, a high level of inflexibility, and they really just like things to be a certain way. Now, you can see a level of compulsivity in their behaviors. For example, things have to be organized a certain way or done a certain way, and there's no other way of going around it. But a person who has OCPD really likes it that way. They don't want to change. They're fine with this order or routine, even if it causes them problems or gets in the way of their relationships. Because of that, sometimes it's a little bit harder to address because a person is okay with these types of behaviors, which is a lot different than an OCD, where most people are really bothered by the symptoms that they're experiencing. One of the things that I think about with OCD is that there's a continuum of behavior. And what I mean by that is that there's some people who have really, really awful OCD, and then there are some people who like to do things in a certain way. Now, we wouldn't call those people, or name those people as having obsessive compulsive personality disorder just because they really like to do things a certain way. But the key point is when it starts becoming impairing to themselves or to the people around them or to their life more broadly. As an example, what cracks me up about my wife is that she can't leave the home without the bed being made. Now, me, in contrast, I don't quite understand that logic because we're going to mess it up again later that night when we go to bed. So why not just leave it all the same? But it doesn't cause really any level of impairment to do that, and it's something she likes, and so we wouldn't consider that consistent with OCD or OCPD. The key is when these behaviors become much more problematic and interfering and distressing, especially if the person can't do it the way that they really want to do it.